What if I told you the test meant to catch ovarian cancer early could actually be missing it in Black and Native American women? And what if that delay could mean the difference between life and death? This isn't speculation. This is actually science, and it's happening right now. So let's get into it. Okay, hey everyone, welcome back to my channel, Medical Tourism RN. I'm Dr. Natasha Ramantal. So today I'm diving into a powerful new study that just dropped, and it's raising some serious concerns about racial bias in one of the most common ovarian cancer screening tools. It is the CA-125 blood test. Okay, this test is often used to decide whether a woman should be referred to a cancer specialist, but researchers found it's far less reliable for Black and Native American patients. So we're talking about delayed diagnoses, delayed treatment, and potentially worse outcomes, right? Just because of the way this test was originally designed. So let's break down what the study found, why it matters, and what needs to change to close this dangerous gap in care. So first, I want to tell you what the CA-125 test is all about. So the CA-125 test, it's a blood test that measures a protein in your blood, which may be elevated when ovarian cancer is present. Okay. It's not a perfect test, but doctors rely on it heavily, especially when a woman presents with a suspicious pelvic mass or other symptoms. Okay. But here's the problem. This test was developed and validated mostly in white populations. And initial studies didn't even record race. Okay, so that means the thresholds used to determine a positive result might not work equally for everyone. So the CA-125 test, it was developed in the 1980s based on mostly white populations, but it is used to detect ovarian cancer by measuring tumor marker levels in the blood. Now, what the study found, let me share which study it is. It's a new study published in JAMA Network Open. JAMA stands for the Journal of the American Medical Association, and it's the Network Open. Okay. They analyzed data from over 200,000 women with ovarian cancer between 2004 and 2020. And what they found is alarming. Basically, Black and Native American women were 23% less likely to have an elevated CA-125 level at the diagnosis compared to white women. So that means that these women were more likely to receive a false negative, okay, where the test appears normal, but cancer is actually present. And that false reassurance can actually delay a referral for these patients to a specialist and ultimately delay their treatment. In fact, women with false negatives started chemo on average 9 days later. And, 9 days may not seem much to some people, but when it's life or death, I think it matters, right? So let's be clear. Ovarian cancer is aggressive, and catching it early can significantly improve survival. Okay. And yet, Native American women, they actually have the highest rates of ovarian cancer. And Black women, meanwhile, we face lower survival rates. So it's important that we are diagnosed as early as possible. So when your main screening tool doesn't work equally across races, we are reinforcing existing disparities instead of reducing them. So health disparities equals systemic, not individual failings. Okay, remember that. Now, the researchers think the reason may lie in genetic variations that are more common in people of African, Caribbean, Middle Eastern, and even West Indian descent. And those variations affect how the CA-125 levels actually show up in your blood. Here's what needs to change. So in the article, which I'm linking that and putting a link in the description, one of the physicians, Dr. Anna Jo Smith, her and her team are basically pushing for a lower, more inclusive threshold for the CA-125 test, one that reflects the diversity of today's population. She was quoted as saying, like, they presented a proposal some weeks ago, and that it could lead to new screening guidelines that better serve everyone, not just a subset of the population. But the issue is continued funding and support for this type of research because it's equity focused, right? Given today's geopolitical climate in the US, with a number of federal policies that have dismantled DEI programs in healthcare and academia, I'm going to let you guess whether continued funding will be made available, at least not in the next 4 years, right? Equity in diagnostics, equals equity in survival. So it's really important that we pay attention to these things. So this isn't just a medical issue, it's actually a justice issue. So when tests and tools don't work equally, essentially what happens is lives are put at risk. Okay, so if you or someone you love is navigating ovarian cancer symptoms, don't hesitate to advocate for additional testing or referrals, especially if you're in the community that has been historically underserved, like Black and Native American women. Okay, I urge you to do that. You know, racial bias in diagnostics is real. Please do not ignore your symptoms. And early detection, it saves lives, guys. So tell your story in the comments, you know, if you've experienced anything like this. But if you found this video helpful, please like, share, and subscribe to help spread awareness. Drop a comment below. I don't know, maybe you've experienced have experience with CA 125, or you just felt dismissed by test results. Let's talk about it. And most importantly, stay informed, stay empowered, and stay healthy. Okay. Until next time, be well.